ก่อสร้างหลวงเลยนะต้องเป็นน้องตาเต่า Itu mami lagi lah. Ah.
Kan kalau berdasarkan hitungan PPI setiap 4 jam ganti kan, jadi kita
Good morning. And welcome.
Good morning,
Yes.
sir.
Good morning.
Thank you. Thank you. Good morning. Welcome, Prof. Farida, for
Welcome.
joining.
Thank you.
And also welcome all the delegates from Indonesia, India. I can see from India, Professor Vishwamandita from KIT University, and Indonesia, all the delegates. Thank you for joining. We are going to start today session. I just share my screen. Today is World Health Day, and we are working on today's theme, our planet, our health. And as we are working towards the health, we are supporting the United Nations Sustainable Development Goal number 3, good health and well-being. Ensure healthy lives and promote well-being for all at all ages. So with this, we have 17 Sustainable Development Goals in United Nations, starting from no poverty. Then second one is zero hunger. Third one, good health and well-being. So we can understand that if we don't have good health, then
Kita mulai ya. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
and if we don't have quality education, we cannot have good health. We cannot get our proper food, and we cannot read out of our hunger. So it is interlinked with each other. If we are poverty, we are poor, we cannot have food, we cannot think about health, we cannot think about education, and if we are not educated, we cannot think about good health and food. We cannot think about life on earth if we don't think about the life below the water. So all these goals are interlinked with each other, and we are working together. Supporting all these goals is networking and collaboration. Partnership for this goal is goal number 17. So today we are focusing on lecture, focusing on good health and well-being, and we have with us our, everybody know, all of you, but still I have to mention for our courtesy, Prof. Farida. She is the postgraduate coordinator for Faculty of Nursing and Allied Sciences from Lincoln University College. She was completed her registered nurse in midwifery. Her PhD is from University Putra, Malaysia, and she did her MSc from UKM, National University of Malaysia, and Bachelor from University of Malaysia. She has many years working experiences in clinical, academic, and management throughout her career in public and private organizations, national and internationally. Her experiences included is she has appointed as clinical nursing director in Medina, Saudi, head of nursing postgraduate research here at present, and of course he was previously also nursing program head in University Putra, Malaysia. She has supervised many PhD students Our niche area of interest include community and public health, nursing education. Her current research interest focuses smart e-health education, and she was awarded Excellent Outstanding Quality Award in Medina. She received 4 research grants when she was in UPM. So today she agreed to deliver lecture on COVID-19 lesson for environmental health sustainability. So we all welcome Prof. Farida to start our session. Prof, the stage is yours.
Thank you, Prof. Sandeep, for very lengthy introduction. You don't have to, I'm a very small, back to you. All right. Okay, thank you so much for your introduction, your invitation, and thank you for all those participants are willing to join this public lectures, which is a very some sort of a mini lectures, so that we use this platform for us to get a new knowledge or reinforce our knowledge, as well as to share our knowledge and our practice, right? So as Andy was saying, this is a lecture. For me, I'm not focusing more on lectures. We are more focusing on how to share our knowledge. Right. Okay, Prof. Sandy, can I make a request? I want to have everybody's camera on so that I can have a photo of myself with all the participants. I'm always like that.
Yes, we request all participants to mute themselves and on camera if possible. If you're not traveling or something, please, and stay with us. Any question, please put in the chat box. Thank you.
Can we have the camera on so that Prof. Sandy can take the picture? So can everybody put on a bit of lipstick or something? Oh, wow. So Brenda has already removed her mask to show her lipsticks there. So maybe anybody can. Prof. Sandeep, are you taking the picture? Done?
Good morning, Prof.
Morning, Eva, Evan. All right. Okay, so is it done? All the pictures? Right. So we can put in our LinkedIn for that newsletter to say that
makanan berminyak dan berlemak juga dikonsumsi.
right. Let me share.
Morning, Prof.
Morning. Okay. Is my slide audible? All right. Okay. Now, okay. Is it okay now? All right. I have 30 minutes, Prof. Sandeep. Only 30 minutes.
Yes, okay. No problem. You start.
If possible, I want to make it. All right. Okay. Now, so today is our lectures on the conjunction of World Health Day. So we're going to focus more on sustainable development number 3, that is health and well-being. And today we're going to focus more on the COVID-19, because this is hot and current, and the lesson that we learned for the environmental and health sustainability. So what we learned is COVID-19 pandemic. Okay, so this is what we're going to go through within that 30 minutes. We're going to discuss the link between sustainable development and it's related among other. We're going to examine the environmental quality that either contribute to affected by the stage of pandemic. We're going to identify the linkage of environmental quality with the emergence of effect of COVID-19. We're going to examine what are the strategies for the environmental health sustainability, health and crime. And of course, the last one, we're going to get what are our action and commitment for the environmental and health sustainability. So to start with, I'm going to give a very simple concept of environmental health. So if you look at environmental health, price of the environmental health, that is 3, but now I'm focusing on the 2. Environmental itself, they have natural and these two natural and human-made environment is very essential for the. So the natural, as you know, is price of land, the air, from the top until the bottom. Summarize that from the air up to the sea. And for the human-made, you can see the necessities that we have now. We have the building, we have the park, we have the beach. This is all for the consumption and the use for the social consuming by the family and right. So this is a basic and essential part. Why I show this? Because I want you all to make sure that should be a balance between the human and the natural as well as the human part. All right. So if you look at this sustainable development goal number 3, so you know that number 3 is about health as well-being. So United Nations 2030 Agenda for Sustainable Development aim is to ensure healthy lives and promote well-being at all stages. So the thing is that have to ensure that from everybody the good time. So part of this goal is the global infection risk. Sometimes they call it IDR. Alongside with strengthening prevention strategies to identify early warning signs. Early warning sign means here is that and warning sign related development that can any infectious. Right? Given the direction connection between environmental change and ID risk, action taken to achieve other sustainable will have an impact on the achievement of it. That means that if not all the other goals will be impacted on that goal number 5. The strongest link that can be expected that will have a good link at goal number 3 is that number 2 up to. So just now, Prof. Sandi already mentioned that SDGs, they have 7. So which now I'm telling about what are the different that are related SDGs.
Nah, ada sistem tentu ya. Kalau tadi bagus lagi. Logistik ini. Jadi saya ketika saya meng-ACC, itu saya bisa melihat langsung di situ datanya. Ini yang tersedia.
To aim is to increase agriculture productivity so that can enhance. Goal is to increase the agriculture productivity. Why we want to increase the agriculture productivity? As goal number 2 said, there's no hunger, zero hunger. So if you increase on the agriculture productivity, so there is surely no hunger, right? So that is what we are talking about link. This is what Sandi was trying to say. There is a link between each of those. So now I'm trying to visualize what are the other goals that are related. So if you look at goal number 1, that is no problem. That's what Prof. Sandi was saying. no poverty, that should be very health and wealth. Similarly, if no zero hunger, number 3 goal achieved. Right? And similarly, number 4, 5, 6, 7, and 8, 10, 11, 13, and 15 is all related to the goal number 3. So, want to know more about how it is connected and related, can go to this article which is being shared on the screen. Right? Okay, now, earlier on, we already discussed what is the concept of environment and that the SDG, all the different types of and how it relates. So now we are going to focus more on the topic that we're going to discuss today. COVID-19 pandemic is a crisis that affects everyone. Various articles have been published on the environmental impact of the COVID-19 pandemic. Right? Many relevant information, research, data, and all press releases issued by the Geneva and other institutions around the world shows positive and negative effect of COVID-19 to the environment. Right? So everybody knows that how much COVID-19 has affected everybody, not only on the human, but it's the environment. So if you look at the negative effect, everybody is aware that how COVID-19 have influence on health of
introduction
or the global health, as well as on the economy, as well as reduction in waste side. Similarly, in the positive side, are always on the positive side. So we look at what are the effects, what are that COVID-19 side. So clean all those our environment. For example, it clean our beaches, become clean because nobody visiting, all the dropped down, so they are unable to strip and to rubbish. Just so the beaches become, and there is reduced in air pollution because everybody stay at, and there is a minimize of plastic because everybody is not able to, and also carbon monoxide on all these things has also been reduced. Okay, and lastly, there is a reduction of environmental noise level. So we have a lot of noise pollution. So there is a positive and negative effect of this COVID-19 on the environment. So now look at other effect on this COVID-19, right? So because of the COVID-19, we have a lockdown. So there is a travel restriction there. And it's also because of those restrictions, it slow down all those activities. So what happened is that when there is lockdown, there's less activity. There's a reduction of fossil fuel consumption. So what happened? All those unnecessary waste at the fossil, right? So that is the positive side. Another one is that use resources consumption and waste disposal. What is the positive side is that reduce the pollution and improve quality. Everybody is aware of the, okay? Reduce transport and industry activities, thus it reduces the noise pollution, air quality, and it also reduces pressure in tourist destination. So it reduces the pollution. It's also on the ecological restoration. So this is all the positive side. All right. How about the negative one? So because of this code, everybody is on the mask. So there are a lot of PPE pressure in the hospital, hamper recycling activities, right? So because of the excessive use of PPE, they have increase of additives. So what happened if we have increase of that hazardous waste, right? So another haphazard disposal of among the public cause a lot of disruptions there. You have a lot of plastic waste, you have soil and water pollution, and you also have increased municipal waste. So everybody is at, they have big out, so they have using a lot of domestic items. So they have waste. So air, water, and soil pollution. Lessen recycling activities, lessen the recycling activities. So it increase on the environmental pollution. So because we never recycle items that recycle. So the thing is that again, there is always positive that any end. All right. So now I'm going to share with you, right? Share with you on the environmental quality that either contribute or it have an impact by the stage of pandemic. How are we going to get this chart? Okay, emergence of this COVID-19. So they believe the emergences of this infectious disease of urbanization. Right? In other words, is that the contribution of this, the emergence of COVID-19 because of the urbanization. Population growth. There is also increase in of the farming. There is some issue with animal-human interaction. See that nowadays we have a lot of issues with animal, and we also have a lot of issues with forestation, and we also have biodiversity losses as well. But this is the factors that contribute of this. So how about the spread? What are the factors that are affected by this time? So they say, they believe, and many studies have shown that the spread because there is a lot of mobility by the human mobility as well as the animals. There is some issues with the climate. There is a change of climate. Okay, we have a lot of climate. Then they have a media, the air and the water. Then they have some behaviors, human behavior as well as animal behavior, urbanization and population. This is all the factors that stay. What are the impact of this COVID-19 pandemic? Okay, what are the impact on that? That is because of factors that the human is having. They contribute by the contributing to the health. Right? The air pollution, such as the air pollution, exposure to lifestyle inequalities, socioeconomic, all right, and the vulnerability population as well as the healthcare system. Right? Similarly, the next phase is that social political responses. Right? So if you look at what are the factors or what are the impact of this pandemic, that the lifestyle and behavior adjustment. So when they have this COVID-19 and pandemic and lockdown, so they have a lot of adjustment to their lifestyle, right? And they have to have redesign and build environment and workplace according to the current situation, right? Reduce their mobility, and they have that psychological and social-economic So we know that how much people has affected by the psychological impact by the pandemic. So this is some of those impact social politics. In terms of socio-economic recovery plan. So what are the recovery plan that they have to think about that? Okay, they have to get the economic recovery plan, the environmental impact, as well as the inequalities of socio-economic citizen of public, and the fairness. What do you mean by the fairness? Fairness of the healthcare system, not only on the healthcare system, fairness of agency, how to how to handle, how to manage when there is another pandemic. Right? This is all those pieces of some factors that the pandemic. Okay, so right. All right. Okay, so this is another reinforcement of what I mentioned earlier on. So they said the emergence of the new pandemic was not unexpected. It's not unexpected. It is already expected. Okay. Study shows that human activities contributed to the emergences and the spread of several zoonotic diseases since 2000, such as SARS, Zika, Ebola. All these are caused by virus. So from that other word, we can say that what we learn from this incident. Pandemic, right? An increase of population and urbanization. If you think about the population growth, everybody live with that in terms of population that is not that number of childbirth. Here is we are with that population urbanization. Everybody is urbanization. Urban. So that is what they call it urbanization. The habitat disruption, the globalization of trade, live animal trade, the import and export live animal, and the intensive livestock farming increase of transmission. So this is all another factors, okay. Increase in the international mobility, and which has weakened the public health system. It might be weaken the public health system, or maybe the public health system itself is weak. Created optimal condition for the increase of the transmission. The emergence and transmission here is that unable transmission is decreased biodiversity, deforestation, and ecosystem balance is the likelihood. This is one of the different factors which is studied by published by all studies. Right? Likewise, study also reveals that climate change. Now we have everybody complaining about there is a climate change, sudden very high extreme heat on has direct effect on the distribution of oceans. The animals, reservoirs, and that is recognized as the key driver of the the thing is that when there is some climate changes, the animal reservoir, especially, and so on. Air pollution may also facilitate the viral spread. Okay. Building itself also contribute to the spread of the disease from the crowded housing, inadequate ventilation, space, and mass transit vehicles that will also facilitate on the virus transmission. This all those published by all this article, the latest article, right? Therefore, a sound information and better understanding of this aspect is critical to both prospects for prevention and to develop action disease management. So how are we going to prepare ourselves if there is another pandemic? Right? All right. So the combined effect of infectious and environmental stressor are major concerns as well. Okay. The severity of COVID-19 is strongly associated with age and everybody, such as lung, heart, all those metabolic like diabetes. Right? So, in other words, there is some it has some relationship with the severity you're affected by. It is directly and indirectly associated to the environmental stressors such as urban design and unhealthy food, as well as the air pollution and right. So not only that, there is some impact of COVID-19 is disproportion in income and minority, reflecting socio-economic factors and vulnerable others. Right? So they have some studies on that. Why it's from income and the minority success. They have to something to back if A is a low social status minority, so they will reflect on the environmental health itself. They are overcrowded, consumption of health. So a survey done shows that when they were asked, do you think that environmental issue is a serious threat to your health? So majority of respondents, because this is done all over. So they found that everybody did that. This is a threat to health. Right? Environmental issue is a threat. Remember, as so now we can get concept of environment. So we balance between the environment and our right. So have you changed? All right. What has this COVID-19 changed this week? So these some responses by respondent globally. So what are the changes that done on human beings? So they said that one most importantly that they said they have some change there. They consume fewer or different and services and frequently parks and at the in space and shifting from they are shifting walking and cycling rather than by and the ordering and other essential online. So this is their behavior change. So that means that they do not out because of the lockdown itself. Right? They are forced to stay. The changes in the workplace is that it's a working from, so everybody is happy to work, and slowly everybody is very stressful when they work as well. So that is another issue that. All right. Change workplace configuration on the ventilation. Okay, that's very interesting. That shows that they already identify the environment is very important in terms of transmission of the disease. So they have on the ventilations on the prevent the spread of occupational exposed to various and protective measures for different occupational group and healthcare, and all this while before the COVID-19, everybody that they have to use on PPE, but the commitment and the compliance are very, very well. But because of the COVID-19, the compliance is higher compared. Reduce business travel, shift to online meetings, so this is normal. That it's some people take it as an opportunity, some people stressful that no business travel. Okay, urbanization. Okay, this urbanization also based on their policy, fuel consumption, they start having pathway for the cycle, right? On the quality from reducing combustion and good environmental and this is about the urbanization. Because one of issues that get is COVID-19 pandemic, which is area which is more affected are around the urbanization when they have a lot of mass. Okay, public health system, COVID tested capabilities in epidemiology data collection, testing and contact tracing, and medical care. Okay, COVID tested capabilities in health crisis management. So, development of specific health surveillance during the crisis also. The increased use of telehealth and reduced visit to the healthcare center is now common. Everybody try to use any random because they feel that the environment is not safe enough for hospital. Okay. Disparate morbidity and mortality among minorities and the poor. Plus public health message from the various sources. Now everybody start open their eyes with this information, right? But there is a negative effect is that everybody, not everybody listen that check. Majority of the negative information. I'm sure everyone understand what I'm saying. Okay, COVID-19 pandemic combined with air pollution, waves, and wildfire, other environment, right? Say that it's now they can see there is connection. So now we're going to move on. What are the different strategies that we need in order to sustain our environmental health? So studies have shown that there are many different approaches, and it's all in basic. We have that sustainable industrialization, have the international action, because we know that how this virus was travel from one to another countries, so they need to have some collaboration in international preventive rate, behavior change in daily life. There is eco restoration and ecotourism. They also have to on their waste recycling and reuse, and they on the wastewater treatment, use of the energy and use of clean and public. But actually, when you look at all these strategies, this is a phase. All right, there is nothing here, but most of the strategy. So, in other words, what they need to strengthen and have and surveillance of some strategy. Okay, let us look at what are the going to at each of those strategies. They say sustainable industrialization. So they say industrialization is very, very crucial, especially in the economy. However, they have to take some steps in order to sustain their environmental health, such as shift the less energy intensive industry not in the urban area, use of cleaner fuels and technologies, and a strong energy efficient policy. So I strongly believe that strong energy efficient policy system, because without any policies or without any SOP, then not be able to sustain our health. Industry should be built in some specific number. So that means that should not build any industry which can cause any pollution, easy and heavy densely. Right? Keep in mind that waste from one industry can be used as a raw material of the others. So this is where they say recycle. I'm sure everybody have heard that. Now they are encouraging recycle for cooking oil and so on. But please make sure when you do that, you send process. When there is no policy, there is some misuse of resources. Right? For hygiene and environmental should maintain the spread of proper hygiene environment should maintain the spread of any infection in industry where a huge number of not only about the huge number of workers are so it should be the quality environment whereby so the sustainable health start, right? Okay, the next strategies is use of energy. Use of renewable energy can lower the demand of fossil fuel and so on. So they have a lot of current research and innovation how to use sources, the energy sources inside the fuel, like the solar and all. Right? Okay. Due to COVID-19 pandemic, global energy demand is reduced, which result in a reduction of emission and increase in the ambient air quality. Right? But wastewater treatment and reuse. So this is not new as well. So we the control of challenges of water pollution, industry and wastewater should be before charge. The use of the treated water, wastewater in non-production process like toilet flush and food can reduce the burden of excessive water. Waste type recycling and use. So this is another strategy to recycle. Reducing the burden of waste and environmental industry and they should recycle. Circular economy and security systems should implement the production process to minimize the material and because we try to minimize the cut of plants and trees in order to hazardous and infection medical waste should be properly managed by guideline. Right? Study concern on the majority of people, especially that have a lack of knowledge regarding the waste regulation disposal. So this is by Rahmat, but I don't. Maybe there is a lack of knowledge, but everybody the current knowledge is quite limited. Lack of knowledge is not issue. Government extensive awareness campaign and mass media regarding the proper waste segregation and disposal should be. What is meant here is that it's not for the campaign or the pandemic and the endemic any political plan. It should be a consistent monitor and surveillance. Right? Ecology restoration and ecotourism. For ecology restoration, this spot should periodically shut down after. So I'm very agree with that, because the shutdown is more maintenance of the environment that is right? Because I'm sure you have some experience in some area where they have environmental is not how. In addition, ecotourism practice should be strengthened for sustainable livelihood, culture, preservation, and biodiversity conservation. So what happened is that some of some center they have some cases where they allow people to have all that hunting and so on. Should or that this one should be okay. Behavior change in daily life, the reduction of carbon footprint and global carbon emission is necessary to change the behavior in our life and consumption or resources, like work process and take local make from space, switch off unplugged electronic devices when not, and use a bicycle car short distance. So some of this real life change that international cooperation, again, as I mentioned on, meet the sustainable environment and protection of environmental resources such as climate and biological diversity. Combined international efforts is essential. So it must have some body from the international agency of environmental health sustainability. United Nations Environment Program is responsible in taking time-oriented policies arranged with the International Convention and the global leader for the. But when you have all those policy without any monetary, that's not help environmental health system. All right. Okay, we already now we are trying to get with our daily life in our office. So now they are encouraging to have very good strategies in terms of safe air. So make sure that you are in a safe air office. Ensure that you are always stay healthy. So how to make sure that there is a safe air in your office? Efficient, energy efficient envelope and adaptive thermal comfort. So this is all this term, something that is they need to have a good ventilation. So all the office, all the buildings should have a ventilation, which able to have as well as temperature. Importantly, compensating the energy ventilation without reaching the terminal discomfort and that to have a very ventilation first able to stay in the office without any discomfort or without any hazard. The hazard is that you have the protection. Airflow, okay, it is related with the first one. Airflow control, you must have a time. So I remember when I was in Saudi, they have make sure that they have a proper ventilation. Most of the time, aircon monitored by environmental quality department, ensure there is trace of bacteria, virus, our ventilation system. Okay, and this is what sure that the environment or the air that we consume from the aircon is clean. Another aspect which is very interesting is that speech intensity reduction. So speech intensity reduction that have noise pollution. So they need to have environment which is pleasant, balanced with the environment and around them. The unwanted sound, which is sometimes harmful, which can also cause the stress in the other stuff, right? Quiet building the noise absorption, so enable to speak softer, thus reducing the bioaerosol emission with combination of acoustic ceiling, wall panel, partition. Such space too, the need ventilation, right? All right. So we're going to that who's supposed to. How are we going to make sure that all the strategies that we mentioned about have 8 strategies? How are we going to make sure these strategies for that achieved? Right? So they need to have a political commitment and political and leadership commitment. It's very, very important. There's no point of other people are very for that committed, but leadership is not there. Then have sustenance. Because when there's no political or leadership commitment, there is no sustenance. Adopt a strategic long-term vision. So you must have a long-term vision. Whenever you do any planning, any strategic planning, you must have short-term, medium, and long-term. Any of the spaces that can be some deviation. So you should go to that. Strengthen policy integration. So the policy integration is to balance of diversity, social, environment priorities for health. The strengthening of this policy integration must involve the expert. Okay. Ensure whole of government coordination. This is very important because any effective and efficient program, they must have coordination. And then good coordination means that have a okay. Number 5, engage engage sub-nation level of government appropriately. So what it means is that when you coordination, so make sure that everybody is at a different level, at a different agency, because we want to have those information from top, bottom, left to right. So it must be sub-national or at all levels. Engage key stakeholders effectively, right? Analyze and assess policy impact. So it's already done all strengthen the policy, not evaluate and not analyze. Right? Most importantly, which are the and everybody have a strengthened evaluation system. For us to be effective and efficient, have a feedback. How are you going to get the feedback? Is from your monitoring, evaluation, and that is very all right. So let us have some something that think that public is lacking knowledge or ideas and action to sustain health and health, environmental health and health. Think so? What do you think? Think that they have knowledge, have lack of knowledge, have no idea how to sustain the environment? Think of answer that. What have individual or the community or the organization or the institution or any significant, any international learn from the lesson from the pandemic? Sorry, my sentence. Learn from this pandemic. Right? Has KAP integrated into the environmental health sustainability knowledge? We will go back to number 1. In that they have knowledge, in that they have practice, they do not have a knowledge, where can they get the knowledge? They do not have a attitude, who should inspire them? Once they have a good attitude, practice. So this is what all right. So another survey, they said, should your government make environment protection a priority recovery from COVID-19? So majority except Germany. So majority China and Mexico, as well as other countries strongly. But Germany, they have some high disagreement with that. Germany and Japan as well. So I want to know about that. Can I'm checking. So as a conclusion, COVID-19 can be seen as a late lesson, and so it's a late lesson because the pandemic seems to be good. Okay? Substantial evidence exposed that environmental degradation is the risk of pandemic. COVID-19 and that escalated the complex interplay between diverse change, such as the ecosystem disturbances, urbanization, international travel, climate change. Always try to find a scapegoat, right? Change on the other side. Pandemic has shown that our society has first potential collective action and change when faced with the perceived. In other words, they have the knowledge, they have the practice, but it's not sustainable. So we have to think how to make sure that we don't have to react or action the emergency. We have don't want to be caught because of the emergency. All right. That's from the unprecedented urgency shows by government in response and does not seem to have a greatly serve as the cause of sustainability. Human health and environmental integrity are interlinked. A transition of sustainable society and economy is necessary to protect. Build back better society. Government must reflect on what and what thought. Have all this collaboration and participation by everyone. So this is for that. The United Nations said that we must have some balance between the economic, environmental, and social. So in order to achieve this goal, it's important to act constructively, utilizing the managing environment, social resources, efficient and effective. So that's my to end my presentation. I said, remember the first diagram. So I said, whenever you have balance, must be, and there is inequality because they have some impact on one another. Right? So we have to make sure that environmental health must be equal to the society. So if you want to do any destruction on this environment of the society, you have to affect when it's being destructed. Right? So this is some of the that and thank you for the attention and save the environment.
Thank
Okay,
you,
thank you.
Prof.
Thank you.
Farida.
Thank you,
for-
Prof.
Thank you, Prof.
Thank you.
Welcome.
Thank you. See you.
Thank
Bye-bye.
See
First, I
you.
want
you
to
so
share
much,
my
Prof.
screen to
Very inspiring talk.
Yeah, very good. Thank you.
thank you to tell Professor for delivering the lecture on COVID-19 lesson for environmental health sustainability. Thank you again, Prof.
Yes.
And I am requesting if anybody have to share your idea, kindly share your views on this World Health Day if you want. And it is open platform, that not that only madam talk and we listen. Of course, we have gathered knowledge about the COVID-19 aspect and other aspects as well on environment and etc. But if you want to share, please share your views. The platform is open for discussion. Thank you.
Yes, I think I agree with Dr. Sandy, Prof. Sandy. Take all these opportunities to share. Sharing, when you share, children as well as other people. Platform is our knowledge. Okay, thank you so much, and thank you for listening and part on your environmental health and your health sustainability. So much, and see you all in future or in future when our book is open. All right, thank you so much.
Thank you.
No evaluation, yeah? No exam and no evaluation.
If there is no question and answer and any discussion, we can end the session. I request all of you to fill the link to get e-certificate. I provide the link in the chat box. Thank you. I think one message is there.
Any question? Sunday?
No, no question.
Okay, all right, so I can leave.
Yes,
Thank
I
you.
think- Thank you
All right.
all of you to join, and we hope all of you to stay safe and healthy. Thank you.
Thank you.
Thank you.
Thank you,
Bye.
Prof. Farida.
Thank you, Dr.
Thank you.
Sandra.
Thank you,
Thank you
Dr.
so much,
Farida
Prof.
and Dr. Sander. Thank you.
Thank
Thank you,
Prof.
Dr. Super.
Dr. Sander.